Hi, my name is Sarah Jefferies, an investigator on this Respirology publication. Fever is one of our oldest and most basic natural responses to infection. Medications like paracetamol and ibuprofen are commonly used to treat the fever associated with infections. International guidelines have recommended the use of these drugs during influenza epidemics. However, there is evidence that fever is beneficial, can reduce pathogen replication, augment the immune response, and may improve survival. In animal models of influenza infection, antipyretic drug treatment has been found to increase mortality. Our hypothesis was that the treatment of fever during human influenza infection may be harmful. So we conducted the first randomized, double-blind, placebo-controlled trial on the effect of paracetamol on viral and clinical outcomes in adults with influenza. We recruited 80 previously healthy adults with community-acquired influenza-like illness and a positive rapid influenza antigen test. Participants were randomized to receive 1 gram of paracetamol 4 times a day or matched placebo for 5 days. Paranasal swabs were taken for influenza PCR at baseline days 1, 2 and 5. Temperature and symptom scores were recorded for a minimum of 5 days. All participants were admitted to the clinical trials unit at Wellington Hospital for 48 hours and returned to the unit on day 5 for a follow-up appointment. While at home, they self-recorded temperatures and kept a symptom diary. At study completion, there were 40 participants in each group. 46 participants had PCR-confirmed influenza, 22 in the placebo, and 24 in the paracetamol group. Our primary research question investigated differences in viral shedding between groups. We found no significant difference between groups in area under the curve for quantitative PCR log 10 viral load from baseline to day 5. For clinical outcomes, there were no differences between groups in symptom scores, temperature, time to resolution of illness, or health status. Therefore, despite international recommendations to administer paracetamol during influenza infection, the regular administration of paracetamol in this setting had no effect. Antipyretics are commonly used across a range of acute infections without substantive evidence of efficacy or safety. We concluded that there remains insufficient evidence for the routine use of paracetamol in influenza infection.